Okay, hi Karen.
Hi.
I'm Dorothy, I'm the clinical educator, and I'll just be interviewing you about your role in the chronic pain management clinic today. Could you just introduce yourself and let us know who you are and where you work?
My name is Karen Jessen. I'm an LPN. I've been practicing nursing for about 25 years. Been in pain management now for the last 7. I work at Covington Pain Management Clinic with Dr. Louis Jacobson.
Great. So Karen, you've worked exclusively with chronic pain patients for the last 7 years. Can you describe the challenge that we as healthcare workers face and the chronic pain patient faces?
Yes. The challenge is to expand the scope of practice management to incorporate the complex multi-dimensional nature of the chronic pain experience. The primary goals are improved function, quality of life, and patient autonomy. The patient's challenge is to live better with chronic pain. In the pain clinic, our goal is to help the patient become less disabled, but not pain-free. And how, you say, how do we do that? We encourage them to have goals, pacing, goal setting, slow and steady. We have them ask themselves, where do you want to be, in a year from now? Get active recreationally, get active socially, get active physically and vocationally. The patients usually come to us isolated, bored, depressed. They've been looking for a quick fix, and they've been shoved around in the medical field to specialist after specialist after specialist because they're looking for a cure. They want to find the reason. They want the pain to stop. Generally, the patients will come to us in a state of despair, depression, anger. They've been given opiates for pain management for maybe many years. They've gone to one primary care physician who's given them, say, maybe oxycodone or OxyContin, and then they might prescribe them for a couple months. And then the primary care physician doesn't feel comfortable continuing to give them that kind of opiates long term. So the patient is abruptly stopped. The doctor says, I'm not going to give you any more. And the patient is frustrated, depressed, doesn't know where they're going to go. Where do I go? I need help with this. Nobody's hearing me. Nobody's listening. So it's very challenging. They have been labeled in the medical field as drug seekers, and even now I will be reading in a chart on a patient, and I'll see I know that patient say they've been in our clinic for several years and working with us, and their life has been transformed since coming to the pain clinic. They no longer focus on the pain of the body, I need a fix. They don't seek help in the medical profession with that view. It's changed from that to how can I live better? And so they start maybe seeking psychiatric help, physical therapy, join an exercise group. They have to start out small because a lot of them come to us and they're very disabled. They haven't worked.
So you talked about labeling, you talked about working with chronic pain patients. When you first started working with chronic pain patients, what was your perception then, and how is it now, and how has that changed over time?
Well, initially when I came, I pretty much had the same the same view as everyone else in the medical field, that there are drug seekers out there, and if you don't see it on an x-ray, if there isn't a specific diagnosis, they're probably drug seeking. They've seen all these different doctors. They're getting opiates from, multiple doctors, and that would be my assumption. And over the years, little by little, as I've learned about pain management, my perception of these patients has totally changed. And I still find myself, once in a blue moon, I will have that judgment in the back of my mind when I first meet a patient, or I look at their history, and I read a lot of the things that many different providers have written about them. Drug-seeking behavior and other things, and it's all in their chart, and it makes me sad because those things are in their chart permanently, and it's a legal document, and these are assumptions. When a patient says, "I'm in pain," we as nurses should remember, or we as nurses should realize that they are in pain. We should believe them. Nobody made us judge, jury, and the ability to know whether somebody is telling us the truth or not. And it's not our job at all as nurses to make that judgment. It's our duty to help. They come for help, and that's what we are to do, is to help them. So I would look in the chart, and I would see all these things, and I might think to myself, well, yeah, I wonder if he's going to put this patient on medication. And they'll come out and he will put them on medication, and I'll think, I don't know. And sure enough, I notice over maybe a 6-month period that this patient went from doctor to doctor, and then for the last 6 months of being in our program, they're only getting medication from us and no one else, because finally they're getting help. Finally somebody's listening, and we've acknowledged, yes, they have pain. So, it's frustrating when I hear other nurses and other people, when they hear that I'm working chronic pain, the first thing they say is, "Oh, it's really stressful. You got a lot of drug-seeking patients, I'm sure." It's unfortunate that we're the last stop for many of these people. I wish it was the first stop. More teaching, more understanding needs to be given to these people. It gives them hope, and it can change their lives. Their pain level can come way down. It may not be taken away, but it can come way down, and their suffering can be reduced, and they can find joy in life again.
All right. Thank you very much, Karen.